very hard, harder than any other place. And her leadership is just absolutely outstanding, and I thank her for all of your leadership on this nomination as well. And so, as we look at this issue, we realized that a whole epidemic was being created, but that epidemic was being created because of approvals of abuse deterrent opioids since 2010. And I put abuse deterrent in quotes because, in fact, it was extremely deceptive because too many people felt that abuse deterrent meant that they could not ultimately become addictive to the patients. The damage had now been done. The prescription painkiller abuse became rampant across the country. We had become the United States of Oxy, and the opioid issue was well on its way to becoming an opioid epidemic. Because when those who were addicted to oxys could no longer afford $60 for a 60-milligram pill, they opted for low-priced heroin, which is why we should not be surprised that of those individuals who began abusing heroin in the 2000s, 75% reported that their first opioid was a prescription drug. So, taking advantage of the new demand for heroin, an incredibly sophisticated network of drug traffickers from Mexico set up franchises in the United States, and now they are responsible for nearly half of this nation's heroin supply and are branching out from large urban areas into our suburbs. These systems collided in a perfect storm that has caused the epidemic we are experiencing today. The overprescription of opioid painkillers that were approved by the FDA. The over-the-top sales and marketing program by a deceptive and deep-pocketed pharmaceutical giant that went unimpeded for years, and an overabundance of heroin flowing into the United States from Mexico and South America. All of that has led us here. We know that nationally, opioid overdoses kill more people than gun violence or auto accidents. Every single day in America, we lose more than 91 people to an opioid-related overdose. Nationally, nearly half of all opioid overdose deaths involve a prescription opioid that was approved by the FDA and often prescribed by a physician. In Massachusetts, in 2016, 2,000 people died from an opioid overdose. And who is the typical victim of an opioid overdose? Who is the typical substance abuser? The answer is that there is none. This epidemic does not discriminate on the basis of age, or gender, or race, or ethnicity, or economic status. It doesn't care if you live in a city or in the suburbs. It doesn't care if you have a white-collar or a blue-collar job. The 50-year-old white male attorney is just as likely to become addicted to prescription drugs or heroin as the 22-year-old Latina waitress. Opiate addiction is an equal opportunity destroyer of lives. Those addicted to opiates are too often stealing from their friends, from their families and neighbors, or complete strangers to fuel their addiction. Cars are broken into, and valuable stereo systems are left intact while a few dollars in change is stolen. Homes are broken into, and flat-screen television sets remain untouched while children's piggy banks go missing. The impacts of opioid addiction are also causing immeasurable harm on the families of those in the unbreakable grip of opioids. Too often, I hear the stories of parents who have drained their entire life savings to provide the treatment and recovery programs necessary to beat this addiction. Many times, it results in bankruptcy filings that were unimaginable only a few short years ago. The opioid crisis is robbing people of their friends and of their family. It is robbing them of their livelihoods. It is robbing them of their freedom as they look out from behind prison bars. And all too often, it is robbing them of their lives. If we don't act now, we could lose an entire generation of people. As this opioid crisis explodes in my state of Massachusetts and in every state in the country, we need an FDA leader who will understand that universal health care does not mean that every American should have access to a bottle of prescription opioids. Last year, more than 33,000 mothers, fathers, children, and loved ones were robbed of their potential when they died of an opioid overdose. But Dr. Scott Gottlieb has openly questioned the value of the Drug Enforcement Administration's enforcement against doctors and pharmacists to prevent prescription opioids from entering the illicit market. The DEA is our prescription drug cop on the beat. But Dr. Gottlieb wants to give that role to bureaucrats at the Department of Health and Human Services, an agency that has consistently failed at any kind of enforcement. At the same time, Dr. Gottlieb has also publicly stated his opposition to the FDA's risk plans, so-called REMS, meaning risk evaluation and mitigation strategies for the use of these opioids. That is what is used to address the safety of opioid painkillers. These vital tools that the FDA has to manage the risks should be made stronger. But Dr. Gottlieb argues that they should not exist at all. Risk evaluation and mitigation strategies, he says they should not exist at all. With the overwhelming majority of heroin users reporting that their addiction began with prescription opioids, Dr. Gottlieb believes that drug safety doesn't need strong oversight. That is simply irresponsible. We are suffering this public health epidemic because Big Pharma pushed pills they knew were dangerous and addictive. The FDA approved them, often without expert counsel, and doctors, because they do not have mandatory education on these drugs, prescribe them to innocent families all across our country. It is a vicious and deadly cycle that has turned this nation into the United States of Oxy, and it must stop. Dr. Gottlieb's Big Pharma formula is simple. Take away the DEA oversight over prescription opioids and give that authority to the FDA. Then, at the same time, limit the FDA's ability to utilize its full oversight authority over these addictive products. That would leave a mostly unregulated marketplace for big pharmaceutical companies and their opioid painkillers to thrive while American families pay the highest price they can: the life of someone in their family. Perhaps most alarming is Dr. Gottlieb's connections to a specific pharmaceutical company called Cephalon. Last month, a Washington Post story was published that indicated that Dr. Gottlieb worked on behalf of one company, Cephalon, to raise the amount of addicted opioid fentanyl that the company could market at the same time the prescription painkiller epidemic was exploding. The Washington Post story details how Dr. Gottlieb advocated for the DEA, the Drug Enforcement Agency, to raise the quota of fentanyl that Cephalon could manufacture and put on the market, even while the company was under investigation for pushing doctors to prescribe the addictive painkiller for headaches and back pain when it was meant for late-stage cancer patients. This aggressive and off-label promotion tactics were out of the Purdue Pharma playbook that got us into this opioid crisis in the first place. Cephalon ultimately pleaded guilty in 2008 to illegally promoting the fentanyl drug and paid a $425 million fine. This relationship is deeply disturbing. Dr. Gottlieb seems to believe that pharmaceutical profits are more important than the public's health. When the prescription opioid epidemic was taking deadly hold, Dr. Gottlieb advocated to put even more addictive fentanyl onto the market when it wasn't appropriate or necessary. Dr. Gottlieb said during his confirmation hearing that the FDA unwittingly fueled the opioid epidemic. But he is guilty of intentionally pushing an addictive prescription opioid onto the American public just to benefit one company, instead of working to prevent this massive public health crisis. Dr. Gottlieb's actions could have made the opioid crisis worse. Serious questions remain about Dr. Gottlieb's association with Cephalon, which was fined hundreds of millions of dollars for violating FDA rules. After his tenure at the FDA, Scott Gottlieb was then hired by a law firm as an expert witness used to defend the actions of Cephalon in court. In advance of this floor vote, I and a group of other senators questioned Dr. Gottlieb on this work and the extent of his historical and financial relationship with Cephalon. But we received nothing that shed any light on his relationship with the company. We cannot have a leader at the FDA who has worked on behalf of a company that aided and abetted the prescription drug and heroin epidemic. Sadly, Dr. Gottlieb is yet another example of President Trump's lack of commitment to address the opioid crisis. President Trump believes that if we just build a border wall, we will end this opioid crisis. We don't need a wall, President Trump. We need treatment. President Trump's support for the repeal of the Affordable Care Act and the legislation the House just passed last week means coverage for opioid use disorders for 2.8 million people could be ripped away. President Trump has proposed slashing the National Institutes of Health research budget by 18%, undercutting our ability to better understand addiction and come up with alternative, less addictive pain medication. If President Trump and his Republican allies are committed to combating the opioid crisis, they should release their plan for addressing this crisis, including committing to quickly release the remaining $500 million authorized last year through the 21st Century Cures Act, and their plan for investing more federal dollars into understanding, preventing, and treating this debilitating disease of addiction. The crisis is wearing families down to the bone, and we need to give them hope. That's what a comprehensive strategy to address this crisis is all about, and strong leadership at the FDA is a critical component of any plan. We need the FDA to be a tough cop on the beat, not a rubber stamp approving the latest big pharma painkillers that are the cause of this deadly scourge of addiction and overdoses. We need to stop the over-prescription of pain medication that is leading to heroin addiction and fueling this crisis. The United States is less than 5% of the world's population, but we consume 80% of the global opioid painkillers and 99% of the global supply of hydrocodone and the active ingredient inside of Vicodin. We also need to ensure that prescribers are subject to mandatory education responsible for prescribing practices. Anyone who prescribes opioid pain medication and other controlled substances must undergo mandatory medical education so that we're sure these physicians know what they are doing. The FDA would be in a position to be the primary enforcer of this critical education. And we also shouldn't allow companies to continue to promote their opioids as abuse deterrent. It is misleading 50% of all physicians believe the abuse deterrent that is on the label means a drug is non-addictive. Physicians don't even know that it is addictive, and we know the Purdue Pharma that this is just not the case. The FDA is in a prime position to ensure that terminology used for promoting a drug is not confusing or misleading. At this time of crisis, we need a leader at the FDA who recognizes the dangers of prescription painkillers, who will stand up to Big Pharma and reform the FDA to prevent addiction before it takes hold. Dr. Scott Gottlieb is not that individual. Dr. Gottlieb's nomination signals a continuation of FDA policies that have cultivated and fueled the opioid epidemic. I strongly oppose Dr. Gottlieb's nomination and call on my colleagues to join me in voting no. Mr. President, I yield back the floor.
Mr. President.
The senator from Maryland is recognized.
Thank you, Mr. President. I join my colleague in opposing the nomination of Dr. Gottlieb and thank him for laying out the case. The FDA, of course, is an important part of our health